I'm Dr. Zoey Stoumbos. I'm one of the ophthalmologists here at Oregon Eye Specialists. The best part of my job is the relationships that I get to make with patients. I had a patient recently who told me that the morning after surgery, when he took his patch and shield off for the first time and looked out his window, he was able to see the leaves on his trees, and he started crying because he forgot how trees looked and how much detail he had been missing in his life. Taking care of your eyes is always of great importance, and during this pandemic, it's no different. I want to address 3 topics that are important for you to know about in order to take good care of your eyes during these times. Let's talk about digital strain first. People are staying home and they are working from home. Kids are going to school from home, so spending a lot more time on screens than we would have been otherwise. One of the main reasons why people have increased strain from using their screens more is from dry eye. Now, a lot of us suffer from dry eye and don't even realize it. There are a couple of things that I recommend. One is to use artificial tears whenever your eyes feel a little bit irritated or when you notice that the vision is getting a little bit more blurry while you're using your device. I also recommend frequent blinking. Another important part of preventing digital eye strain is making sure that you're wearing the right glasses. Oftentimes people will have a pair of glasses for distance or maybe a pair of reading glasses, but not realize that the prescription that they need for that computer distance is slightly different. I also recommend taking frequent breaks. You can follow the 20-20-20 rule. So every 20 minutes of screen time, take a 20-second break and look at something that's 20 feet away from you. Let's talk about routine eye exams next. Having an eye exam is really something that everyone should be doing every 1 to 2 years, depending on your specific eyes. Not only are eye exams important to keep up the health of your eye, but also the eyes serve as a window to the rest of your body and can be helpful in keeping your overall health intact. Some of the conditions that we can detect on a routine eye exam include diabetes, high blood pressure, leukemia or lymphoma, multiple sclerosis, rheumatoid arthritis. I've seen patients come in before for routine eye exams not having any symptoms at all, otherwise healthy, no medical problems, and findings on their eye exam have ultimately led to the diagnosis of brain tumors. Even during this pandemic, it is important to not neglect the care of your eyes. Here at Oregon Eye Specialists, we are meeting and exceeding all of the requirements set by the state right now. The last thing is, let's talk about 4 different conditions that everyone needs to know about. Let's start with glaucoma. Glaucoma is often called the silent thief of sight. It starts by taking the periphery of your vision first, and it's such a slow process that you don't even realize that it's going. By the time it gets to the point that you do realize that you've lost part of your vision, it's fairly advanced at that point. Glaucoma does tend to be more prevalent as we age, but it can happen at any age. But as long as we're able to catch your glaucoma early, do routine screening, monitor your pressure, make sure we keep your pressure where we want it, we have a good chance of being able to preserve your vision. We have a lot of different treatments for glaucoma. The most common way of doing this is with eye drops. So we can also use laser to lower the pressure in the eye, and if none of those options work, there is always surgery. Dry eyes are a very common concern for people, especially with the pandemic these days. One of the main causes of dry eyes is if the oil glands in your eyelids are backed up a little bit. It can cause a lot of different symptoms, including crusting, itching, burning, eyes watering, which I know sounds opposite for dry eye, but eyes watering are often a sign that the eyes are dry. There's a lot of different treatments that we have available for dry eye as well. Warm compresses are often recommended. The heat from those compresses helps soften up the oils, helps keep it flowing to the eyes. Artificial tears are another big treatment, just keeping the eyes lubricated. Fish oil and flaxseed supplements are also helpful for dryness. Diabetes is one of the leading causes of blindness in this country. Diabetes can affect your eyes in many, many ways. For diabetics, it's important to see your eye doctor at least once a year, sometimes more frequently. If diabetes is affecting your eyes, there are sometimes treatments that are recommended. As with most conditions anywhere else in the body, and including with the eyes, the earlier we can catch diabetes affecting the eyes, the more effective our treatments might be, and the better chance we have of preventing permanent changes to your vision and to your eyes. Finally, let's talk about cataracts. Cataracts are something that everyone will get at some point. Cataracts are a normal aging process of the lens in the eye. It's like taking a clear window that you were looking through as a kid, getting a little bit more hazy with time. Cataract surgery is the most common surgery that we do as ophthalmologists. It's an in and out surgery, and many people will notice an improvement in their vision even the next day. I hope you've learned something about eye care. At Oregon Eye Specialists, we strive to deliver clarity, and we truly care about caring for your eyes and for you as a person.